Well, they say the eyes are the windows to our souls, and sometimes they're also the windows to our age. Under eye bags and droopy eyelids are a problem many face as they grow older, but there's a simple procedure that can significantly transform your appearance. Joining me now is Dr. Beth Collins, a plastic and reconstructive surgeon, and her patient, Conni Stone. Dr. Conni, thank you so much for being here.
Thank you.
So, doctor, this is not a very overwhelming procedure. This is something you could do in your office.
Yeah, sometimes you could do quite a lot in the office, and it's really comfortable, and especially in the eye area and the place from here to here that I call the mid face.
Right.
Just doing something to intervene to just freshen up that area makes a huge difference for people. And in fact, I brought Conni along because we did that specifically in the office to her. So.
And you're happy with the results, Conni?
Yeah, I am. I've just had the upper lids done so far, but it was...
and we put some volume in
yes,
your...
and we put
Yeah,
some
but you
volume.
do. Your whole face looks bright. You could tell something,
Yeah,
right?
yeah. Oh, absolutely.
Yeah.
You can see the difference, but not so much that people are stopping me going, what did you do? You know, it's just a subtle difference, but...
Like a well-rested
Fresh,
look, right?
yeah.
Very
fresh
natural,
look.
very
Yes.
natural. You almost have to put the picture side by side of Conni to see. Well, you don't have to. Of course, she looks beautiful, but when you see it side by side, I think we do have pictures.
We do.
of
In
it
fact,
that-
let's put up some before and afters,
Yeah.
doctor, and you could explain what we're looking at.
Okay, so, well, this isn't Conni, obviously, but this is somebody that we did, so you could see under her eyes, just some volume under her eyes in the office. So this was totally an office procedure. It took about a half an hour. Downtime, almost nothing.
That is dramatic. I mean, she's
Dramatic.
got some bags
yeah,
in the
and
first
that's
picture.
an office procedure. And here's to point out that even men do this procedure. Those are upper eyelid, we call it a blepharoplasty. And so we just took some skin off the upper eyelids, and you know, people come in, men especially, say, I don't want to look like Kenny Rogers. And
Well, that's a bit much, right? He's kind of gone overboard.
he has, and here's somebody who under eyelids done. So just those little small tweakings that we could do, these things, a lot of them in the office under local anesthesia, very minimal downtime, but with enormous, huge benefits associated with them.
You took years off his eyes.
Yeah.
It looks
He looks
fantastic.
much better.
Much younger, too.
Yeah.
So walk us through the procedure, Dr. Collins. How does it work?
So it depends what we're doing. So here you could see we have some video of what we were doing with Conni specifically, and she had some hollowing in her upper eyelids and some extra skin and was lacking a little fat up there, and there I am sort of measuring things out. And this is to show that it's all done under local anesthesia. So she is wide awake for this, and I think she'll tell you it's not any worse than just going to the dentist, really. So the local procedure, take some skin out, and you can see here it's just real simple. I have an assistant there with me, a surgical technician who helps me. And here I am. I use some of Conni's own fat to put into her, transfer into her cheeks, and that gives her some volume into the cheek area. And once you see the end result, you'll see that that volume really helps those lower lids. You have to kind of prepare the fat and get it down into its basic component.
Do you notice the difference where you pulled the fat from?
You don't take that much out of there. Here we are putting it in. Her eyelids are done right there, and you could see she's she doesn't feel anything while we're doing this, and all done under sterile conditions right in the office. So what I do is, you know, we'll give a little medicine to relax your nerves, just a tablet to relax your nerves, and then everything's local anesthesia and really profound results. So.
Absolutely. In fact, let's put up the before and after pictures of Conni, and we can see just how great they are.
Yeah, so if you look at her eyelids, we got rid of that hollow in the upper eyelids and took away that flattening of the cheek area, and it just ever so subtle and lovely, and you know, so.
Conni, how's it changed your life?
Yeah, well, you know, I did it for myself, and it just makes me feel more comfortable because I felt like every time I looked in the mirror, I always looked tired, even if I had slept for 12 hours. So it really made me feel better about that. And I always say I did it for my grandchildren because I want to be a young grandma for them. So
I like that. Well, very good. I'm glad to hear you're happy with the results. And Dr. Collins, you have a fun event coming up April 23rd.
I do. We're doing an injectable event on the 23rd, so all day long we're doing some discounts on the actual injectables. So it's it's a great time to, if you've never done it before,
fling,
come
right?
in and try. Get yourself looking great for the summer.
Yeah, and that's pretty easy stuff. No downtime. You can come on your lunch break, right?
Yeah, absolutely. Yeah, it's a wonderful way to just get a little freshening up.
Fantastic. And of course, for more information, you could visit Dr. Collins, visit bethcollinsmd.com. And of course, your office is in Guilford.
That's right.
Very good. Thank you both for being here.
Thanks
for
so
sharing
much.
your
It's a
results.
pleasure.
Ryan?